Dear friends of Hadassah, first I would like to welcome you and thank you that you took the time to join today's webinar, The Corona Pandemic, Evolution, Findings, Outlook. With a lot of pride, I can mention that tonight's event has attracted 180 registrations from 18 countries. Needless to say that this has nothing to do with my person. It is because of our guest speaker, Professor Yoram Weiss, who has a huge fan base within Hadassah supporters. The schedule of the next 60 minutes is as follows. First, you will be welcomed by Dr. Janice Weinman, CEO of HWZOA, Hadassah, the Women's Zionist Organization of America. Next, we will have a fireside chat with Professor Yoram Weiss. Professor Yoram Weiss is, as most of you know, a world-renowned expert in sepsis, septicemia, and pulmonary failure, who during the corona crisis frequently served as an interview partner, for example, for CNN. After about 35 minutes, we will open the discussion to our audience. If you have questions, you will have the opportunity to ask them by using the chat function of Zoom and type them into the designated field. The questions will then be forwarded to Professor Weiss. When we planned this meeting, I was hoping that we could limit ourselves to speaking mainly about the past, about the evolution of a new disease called COVID-19, what we've learned, and how Israel, and especially Hadassah, have dealt so successfully with the virus. All of us were proud to read in the international press that Israel was among the top 3 safest countries worldwide during this pandemic. All of a sudden, we were being confronted with news of a second wave. And our honorable speaker, Professor Yoram Weiss, Director of Hadassah Hospital Ein Kerem, will explain to us what went wrong. Before we'll go to the medical part, let me welcome Dr. Janice Weinman. Most of you will be familiar with the slogan, Hadassah more than a hospital. This slogan refers to the fact that the Hadassah Medical Organization understood from early on that the Hadassah state-of-the-art medical treatment of patients, disregarding their origin or religion, as well as research and the passing on of knowledge, could serve as a bridge to peace. More than a hospital also relates to Hadassah's fabulous nurses and doctors who care so passionately for the people searching for help. When I joined Hadassah Switzerland about 10 years ago, I realized that there was another incredible asset of Hadassah, making it more than a hospital. And that is the women of Hadassah. Dr. Janice Weinman is one of these extraordinary women, and she would like to say a few words to you. Please, Janice.
Thank you. So good evening to those of you who are in Europe, and a good afternoon to those of you in the United States. I would like first to say a few words in German to those of you who are in Europe, and then I will speak in English. But I just wanted to say, dass mein Name ist Janice Weinman und ich bin die CEO von Hadassah. Ich freue mich sehr, mit Ihnen den Abend zu verbringen, und ich danke Manno Saks und Jorge D. gefragt zu sprechen. Mein Vater war von Prag und meine Mutter von Wien. Sie sind beide nach Amerika gekommen in 1948 nach dem Zweiten Weltkrieg. Wir haben beide Deutsch und Englisch gesprochen zu Hause, aber ich spreche Deutsch nur sehr selten jetzt. So, ich werde meistens sprechen in English. So what I said was that my name is Janice Weinman. I'm the CEO of Hadassah. I'm very, very delighted to be here with all of you today. And I thank both Mickey Saks and Jorge Diener for having asked me to join you. My father came from Prague and my mother from Vienna. They both came to the United States in 1948 after the war, and we spoke both German and English at home, although I don't speak German very often anymore. I wanted to say how happy we are that this group has formed and that it is meeting today, and we thank you again, Mickey, for that. This is the first time, I believe, that you are meeting, and I hope that we will have many more times to come together. Hadassah, as Mickey has already said, in our hospitals serve and our 300,000 members in the United States, both as well as in South America, in Israel, in Europe, are really special in so many respects. Our first hospitals, first of all, provide state-of-the-art treatment to 1 million people a year. They conduct research and have been awarded 60% of the National Science Awards in Israel. And with the Hebrew University, we provide clinical and academic teaching to hundreds of people a year. During COVID-19, we were unique in several ways, and I know that Professor Weiss will speak to this, but I just want to cover some main points. First of all, we set aside an entire building to isolate patients for treatment. It was a building that we're renovating, and so it was easy to, in fact, just remove all of the other patients and to use this solely for the treatment of COVID. We were designated as a top laboratory for testing in the country. We tested our own staff every 5 days, which was really unique for Hadassah. And Professor Weiss, who was very, very involved in the process, was featured on CNN, just for a second, I must admit, as an example of the procedures and policies that really should be administered by everybody. We provided some childcare. We distributed hand sanitizer that was made by one of the subsidiaries of Hadassah. And we are now doing research that I was going to mention to you, but I think that Dr. Weiss will do so far better than I. We do so in everything we do with regard to the background of our patients. Mickey has already mentioned the fact that we have, regardless of religion, ethnic identity, or place of residence, we treat everybody equally, Arabs and Jews alike, Muslims and Israelis, and we're completely blind on the background of people who come, having resulted a number of years ago in being nominated for a Nobel Peace Prize for Bridges of Peace. We have undertaken humanitarian outreach throughout the world, in Haiti, Ethiopia, the former Soviet Union, and through Hadassah International in Chile, in Mexico, in Argentina, at least. Our 300 members in America participate in advocating for federal legislation for Holocaust education, for aid to Israel, and for funding of women's health programs. And as you, they fundraise for the hospital. So in German, I would like to close, and then I will repeat myself. Ich danke Ihnen für alles, das Sie tun für Hadassah. Als ich ein Kind war, bin ich gegangen jeden Sommer zu Vaduz, Liechtenstein, und nachdem zu Zürich. Ich hoffe, dass nachher ich werde Sie treffen, alle zusammen in der Schweiz. Vielen Dank. So I wanted to thank everybody for all you do for Hadassah. When I was a child, I used to go to Vaduz, Switzerland, Vaduz, Liechtenstein, every summer, and afterwards to Vaduz, where I thought this event was actually taking place. So I hope that in the future, I will have the opportunity to meet the group from Switzerland in your home country and to continue our conversation together. Thank you so much.
Thank you so much, Janice. Yoram, thank you. Thanks to you too. Thank you so much for taking the time to give us an update about the latest developments during the corona pandemic in general, and especially in Israel. Last night, I looked at the most recent numbers in Israel. Israel yesterday reported 859 new cases, the highest single-day total since the start of the pandemic. There is a total of 25,547 infections. 320 patients have died. We've seen 17,400 recoveries in the meantime. 7,838 cases of COVID-19 are active, 56 of them in critical condition, with 24 on ventilators. As per now, we have not seen signs of a second wave in Switzerland or Austria. Is this a matter of demographics, mentality, or more frequent testing? And how is Israel going to react to the latest developments?
Life is very complicated. So first of all, I'll say guten Abend für alle. Und ich freue mich, mit Ihnen zu sein heute Abend. Aber es wird unmöglich sein, in Deutsch zu sprechen. Meine Mutter wird es nicht viel Freude machen, dass ich vergessen, Deutsch zu sprechen. Aber es wird in Englisch sein. Anyhow, what I wanted to say is that it's a very, very complicated picture, what we see in Israel. And I think we need to understand that, first of all, there's no question that as Israelis, what happened to us, that we had a very good success. And as Israelis, we got very excited and we thought that everything is over. And we started coming back and living our lives. And what happens is with COVID, with the virus, that the moment you think you are living your regular lives, then very quickly it comes back to hit you. And Israel is not the only place. If you listen to the television and to the networks, then you see other places in the world where things went wonderful, and suddenly people had to go back and to understand that social distancing is a key part in preventing the infection of others. And I can start with Singapore, where they had to go back and understand it. And actually now also in California. California was doing fantastically. And also California now has a major problem, as we have in Israel. The only difference is from the first wave is that at this point, the infection is mostly with younger patients. And we see it. When you look at the demographics of the disease at this point in Israel, you will see that it has shifted from elderly patients being about 65 years old to a younger population of about 50 to 55 years old. And this means that we have a much higher representation of both kids, where actually things start to deteriorate is in schools, and then also in the younger population of about 20 to 30, which went out and partied in the restaurants and the nightclubs and everywhere else, and on the beaches, by the way. So the reason for that is also, and we can see it, and I would like, if you allow me, Miki, to share for a second, a screen which depicts, and I hope you can see it now, and this is the real dashboard of Hadassah, where we track the infection. And what you see here is the first day that we admitted the first 3 patients. This is on March 11, and you see how quickly it came up. And we were very quickly with we had a lot of patients also in the ICU. Now, if I take you now towards where we are today, and you see that we are already now nearly for 2 weeks running in an outbreak in Israel, and you see that when you look in the hospitals and you look at the number of patients that are hospitalized, you see that there's basically, I wouldn't say a plateau, but the rise is very, very slow. And the reason is because of the demographic of the age. Nevertheless, the Israeli government understands that we have a major problem at our hands, and we all believe that within the next few hours, the government is unfortunately going to take some steps that will bring back a very forceful social distancing in Israel in order to curb down the infection rate, which is really very skyrocketing and very concerning.
What you're basically saying is that the coronavirus keeps mutating also. One finds evidence in the medical literature that a common new variant of the spike protein called D614G makes it more infectious on one hand, but at the same time, maybe less dangerous, which would explain why a smaller proportion of COVID-19 patients ends up being hospitalized in serious condition. Can you confirm this observation?
As I know this, I can tell you that I personally think that every virus is mutating. Now the question is, did we see a major shift, a major mutation? And the answer is that at this stage, we didn't see a major mutation. I want to remind everybody that the coronavirus, the novel coronavirus that we have under our hands today, is a mutation of a coronavirus that we've seen two other types, which were and are extremely dangerous. One is the SARS virus from the beginning of the 2000s, where the mortality rate was about 30% for those who were infected. And then we have the Middle Eastern SARS, which came out of Saudi Arabia, out of camels, and this one has a mortality rate of about 70%. Now, it is important to understand that viruses mutate. I think that at this point, even if there's a mutation, it's not a significant mutation. I think that although the virus is not so dangerous for most people, but for those that have either first a background of medical disease that compromises their airways and also their immune system, these patients are at very high risk, and we see it all over again. And also we see it in the elderly population. Now, the reason for those that we don't know yet, that have mutations in their inflammatory response, in their immune system, that react very strongly to the virus, are those, and these are also young people, that can get a very, very severe form of the disease. And the virus can be very debilitating both at the acute phase, when these patients end up in the ICU and require a lot of both hemodynamic to support their blood pressure, their heart, and obviously their lungs, but also on longer terms, when we see the side effects of the virus continuing for 2, 3, and sometimes even 4 and longer time. And for this reason, we have also the chronic syndromes that are starting now to come up with the virus. So to answer your question and to summarize what I wanted to say is, yes, there may be a mutation, but the mutation is, in my opinion, and not only mine, most people understand, is a very, very minute mutations, and these are not major mutations. I do hope that we don't see a mutation that will make the virus much more deadlier and much more dangerous than it is now. But even in its current form, it's and I think here also most of us agree today, although it's not a major killer, but for those who get the severe form of it, and this is about 2% of the population, it's a very, very nasty and dangerous virus.
Absolutely. Still, Yoram, the fatality rates seem to go down worldwide. For example, in Italy, where there were 25% at the beginning, down to 2 to 3% now. And as you said, that can probably be attributed mainly to the younger age of the patients. But do you think that viral load reductions, advanced phases of the disease, or better patient management with a higher rate of non-invasive ventilation play a role in this?
I think you answered your question. You answered the question yourself, and I fully agree with you, by the way. I think that the major issue, the reason we see today a decrease in mortality, is because both in Italy and in other places in the world, they were able to bring down the curve. And for this reason, they see less severe patients. And the moment your ICUs are not overflooded, you can provide care to these patients and you can support them and you can actually allow them to withstand the infectious process. Further to that, there's no question that as time is going by, we tend to see more drugs that come in, and some of these drugs may be beneficial to reduce the mortality. And these are drugs that have, I would say, there are 4 kinds of drugs that are coming up now. One are drugs that prevent the entry of the virus into the cells, and they prevent the connection between the spike protein that you mentioned at the beginning and the ACE2 receptors that are the ones that allow the virus to penetrate into the cell. So this is one kind of drugs. Then we have the drugs to stop the replication of the virus within the cell. And this is a drug that was approved in the United States called Remdesivir. And then we have a third drug, which is, or 2 more drugs that are coming up. And these are drugs that are interleukin-6 inhibitors, and they prevent what we call the cytokine storm, the inflammatory response that is killing patients. And these are drugs that stop a interleukin that is very important in activating the inflammatory response. And finally, just recently, we had the study published by the British group that showed that steroids, dexamethasone, are also very powerful drugs in a very subspecific group that are either not on ventilators, but also those on ventilators that have a severe inflammatory response, where giving steroids can bring down the mortality rate by using these steroids. So as we go along, we learn more about how to manage the disease, how to bring down the infection load, and how to manage the inflammatory response. And the more we learn that, the more we allow patients to recover. And finally, there's no doubt that we learned a lot about how to use non-invasive ventilation. And when we started taking care of these patients, we used to, all those that had pulmonary problems, we used to intubate them. And now currently we're trying actually to prevent intubation and use what is called non-invasive ventilation, which is giving patients high flow of oxygen and not to put in a breathing tube into their windpipe in order to support their ventilation. Because we realize that if we keep the patient breathing by himself, the chances to allow him to recover will be much faster.
Thank you. Yoram, you and I were on the phone 2 days ago, and I confronted you with a theory which you did not agree to, but I'm still going to ask the question once again because I like the way that you answer it. So I asked you, can you say that the virus seems to be adapting to the human being as a host and doesn't want to kill us, but live in us and flourish?
So my answer was that viruses are not human beings. And actually, if you look at the virus is basically even not a DNA virus, it's an RNA virus. So it's a very, very primitive form. And what's happening is that the virus is basically mutating, and just by chance is by finding its way into finding a loophole in the immune defense of the human body. And that's why it's starting to attack us. And what will happen is that as time goes by, the virus can suddenly disappear. And as it came, and we've seen it with the SARS virus, for reasons that we don't understand until now, we know that the SARS virus suddenly one day disappeared. And if you remember also, and I was mentioning it today to my wife because everybody's frustrated by the fact that, you know, we don't have summer vacations. And I mentioned to her that exactly 100 years ago, 1918 to 1920, there was the Spanish flu, which was also a virus that was extremely deadly. And it suddenly appeared, and one day suddenly it disappeared, and we haven't seen it since then. So viruses have their way of doing. It's not because they are understanding us or feeling us or sensing us. It's just the regular behavior of the microcosmos, if you want, and of, in a way, the where we are. And nature is showing us that although we are humans and we think we control everything, at the end of the day, nature, and someone will say maybe God, is showing us that still as humans, we need to be humble, because suddenly nature can bring upon us surprises that we don't expect.
Thank you. So now let's go back from theories to facts. More than 10 million people infected today worldwide. 505,000 people have died from the disease. Israel has reacted to the rising numbers by setting up exclusion zones, reopening corona wards in the hospital, and by digital monitoring. The whole world is eagerly waiting for a powerful new medication and or a vaccination. So how do you see things evolving in this field?
So first of all, I would say the following, that when it comes to developing monitoring devices, there's no question that there's a huge, what the virus has created, it has created a huge pressure for technologies that were on the background and we didn't really tend to use them so much. It moved it to the center stage of medical practice. And there's a very nice, in New England Journal of Medicine, actually today, there was a very nice editorial speaking about the fact that telemedicine, that for years was on the back burner of us physicians, is suddenly a center stage. Because the fact is that all of us understand that it is impossible to stop medical care. It is impossible not to understand that we need to continue with our lives. And on the other hand, we have the problem of the virus, and we need to see how to mitigate these dangers that the virus is posing on us. And for this reason, we need and we must continue to treat our other medical problems. And for this reasons, anything that is related to telemedicine, we'll see over the next 2 years will come up, and I believe will stay with us for a longer time. Secondly, in our wards, in the hospitals, because we would like to protect our teams, we will see more and more the technology that is remote monitoring that will come into practice, because these devices can prevent the direct contact on the continuous contact, which is unnecessary today, between the patient and the nurse or the physician, except for when it is needed. Now, I should say that it is true that in most of our intermediate units, you can easily make monitoring of a patient without being close to him. But when it comes to the ICU patients, unfortunately, still, us human beings, nurses and physicians, must be close to the patient in order to allow these patients to survive. So Israel has opened its wards, it has opened its intensive care units, and Israel is gearing up to be able to ventilate about 2,000 patients, coronavirus patients, if needed, which is a lot. I think that I'm a little bit more optimistic. I hope we don't get to this point. And I think that with people understanding, and there's a big advantage by the fact that we're doing a very huge effort now in Israel to actually sample the population for two reasons. First of all, we are at a stage where we're sampling between 20 to 30,000 patients a day, which means that Israel is now one of the countries that has the highest rate of sampling of patients. Now, it is obvious that, as one of our presidents said, President Trump, the more you sample, the more you discover. But in a way, it's true. The more you sample, the more you discover. And this allows you also to take steps in order to mitigate and to contain the disease. And for this reason, I think that still, although we in a way lost control of the disease, but I think we're taking the right steps in order to bring it back under control. So I should say that, and maybe I'm a little bit naive, but I'm still optimistic. And I think we still have the chance because we see that the disease is especially present among the younger population. And as long as it is not spread within the older population, it gives us the chance to bring it under control.
As for a vaccination, I'm surprised to read in the press that you know, some are a little more courageous and they say eventually we'll have a vaccination this year. Others are more reluctant and they say, well, maybe first half of 21. I actually am a bit more skeptical because one must not forget that HIV has been around for decades. Billions have been invested in finding a vaccination, and we're still not there yet. Do you see similarities between the HIV virus and the coronavirus that make it difficult to find a vaccination?
I would say the following. I'll be honest. I myself believe that it will take longer. And I don't believe that by the beginning of 2021, we will have a vaccination for everybody. However, on the other hand, I would say also, and this goes into trying to look at the pessimistic side, we know that for the coronavirus, the SARS coronavirus, which was very dangerous, and also for the Middle Eastern SARS, we were unable to develop vaccination. On the other hand, it is important to understand that there's a huge effort now being placed by many governments and also very, very strong companies that are putting a lot of effort in developing vaccines. And we know that a few companies have already very, very major advances in developing the vaccine. The group in the United Kingdom has made some very significant advances, and also an American company called Moderna apparently has also made some advances. Now, because of the huge investment and because of the level of disruption the virus is causing, I think there's a lot of money that is being poured in order to develop the vaccine. So I don't know if we will have a vaccine within the next 2 months or 6 months or a year. I think at the end we'll have a vaccine. But then comes another question. And the question is, for how long will the vaccine be effective? And for this reason, we must understand two issues. One, we can take the vaccine for measles, which we're giving a measles vaccine shot, and we will be protected. About 97 to 98% of us will be protected for their entire lives. On the other hand, all of us know that if we speak about the flu vaccine, we know that we need to take the shot every year because every year there's a small mutation and we have to repeat it. We don't know yet, and this goes back to your question before about the mutations, if the coronavirus isn't like a flu virus and it will mutate all the time and we'll have all the time to develop actually a new vaccine or a specific vaccine for the season in order to control it. So in short, I believe we'll have a vaccine. The question is, for how long will it provide us with a coverage to give us immunity? And the question is, how quickly will the companies be able to bring up the level of numbers of vaccine to provide vaccination for an entire population of the billions of people in this world that need a vaccine?
Thank you. Yoram, when preparing for this webinar, I found some publications in the medical literature which kind of scared me. These articles stated that up to 50% of cured patients still suffer from diverse symptoms like psychological disorders, fatigue, anxiety, pain, breathing problems, and so on. Do you want to comment on that?
Okay, I was muted, so sorry. Okay, could you repeat the question? I'm sorry. I don't hear you now. Now I don't hear you. There's a problem with the line. Now I can't hear Mickey. No, I can't hear you, Mickey.
Can you hear me now?
Now I hear you.
Yeah.
Now I hear you. I'm sorry.
Okay, no problem. I just said that while preparing for this webinar, I found some publications in the medical literature which really scared me. These articles stated that up to 50% of cured patients still suffer from diverse symptoms like psychological disorders, fatigue, anxiety, unclear pain, and breathing problems. Can you comment on that briefly?
Yes, and the answer is that we know that some patients, after having suffered from the coronavirus, will develop both psychological and also both medical problems that will continue. And this is one of the reasons that many hospitals are open and many also health management organizations have realized that they need to develop systems for post-corona treatments for patients that have suffered from coronavirus. And these patients will require support. You must understand that in a way it's not surprising. If you think about it, every patient that is in the ICU for a longer time and is being on a ventilator will end up, and this is sometimes for a week or 2 weeks, because most patients spend about 10 days when they get ventilated on the ventilator, they end up with what we call ICU myopathy, which is a severe weakness of their muscles. And on top of it, we know also that they have psychological problems of post-trauma stress disorder and stuff like that. Add to that that the virus also is causing some changes in our vasculature. We know today that the virus is not only attacking the respiratory system, but it also makes changes to the endothelial cells. And it may also cause some blood clots in certain vessels, small vessels in certain organs. And this can also create some late stage problems. For example, we know that some patients will have one of their complications of the virus, a cerebrovascular accident, CVA. So the virus is very complicated in its action. And for this reason also, the subsequent results of the virus and the side effects can be long-term, and we need to be aware of them, and we need to support these patients.
Have you heard about reinfections yet?
It's a very good question and a very problematic one. And this goes back to the level of the question is, for how long does our immune system work? And it is important to say that some people say that people that were infected with the virus may actually be reinfected after a period of 6 months or something like that, or even maybe longer. Do we have a full proof for that? The answer is no. Do we have really a study that has shown it for 100%? The answer is no. But there's a possibility of reinfection. I should say that no question that this brings us back to the point of the vaccination, and it's the same thing, is do we, post being exposed to the virus, do we develop an immune system that will remember our remote cells? Will they remember the virus and be able to fight it for our entire lives? Or will we actually be needed to get vaccination in order not to be infected once more, as we get with the flu? Remember, with the flu, you can get the flu 1 year, the next year you get the vaccination, and the third year you're reinfected with the flu. We don't know yet. The answer is, I don't know, and I think no one really knows for 100% at this point.
Okay. Yoram, time has progressed, unfortunately, and I have a whole page of, I find very interesting questions that I wanted to ask you about ethics and dark rate and transparency and so forth. But I think at this point, we should open the forum to the public. Attila has collected questions that the audience has put into the chat, and maybe we should continue by hearing these questions first.
Yes, Professor Weiss, one of the questions that we received is related to a news that swine flu is on the rise in Israel. Is it true or it's a fiction?
I can tell you that I didn't hear that swine flu is on the rise. I would say that the answer is that the answer to that is that from our point of view, swine flu is part of the flu viruses that we are addressing every winter in Israel today. And there's no question that one of the concerns with the next flu season is that if we get a flu season together with the coronavirus, it can be a very dangerous combination. And for this reason, there's a huge effort in Israel to try and vaccinate as much people as possible, except especially those elderly patients and those with diseases that make them more vulnerable for the virus with a flu vaccine. And I would tell everybody here from all over the world that if they can, they should, especially those, the older participants and those with other diseases, they should think very carefully about getting a flu shot this year and this season before the next winter. I think it would be very, very important.
Thank you. Another question is about a news that yesterday was presented in the US about a new drug that treats COVID-19 and which the US already purchased the entire production of this drug for July and August. Would you please comment on this if you know about it?
Unfortunately, I don't know about it, so I can't comment about it.
Understood. These are the questions that we received until now. Mickey, if you would ask anything, another question.
Yeah, something that I was wondering about all the time, and maybe you have an answer to this too, is why are the numbers of infections being presented to us as cumulative, thereby scaring all of us? And why are recoveries not being deducted when these numbers are presented to us?
It's a good question, and I think it's not being done in order to scare us, but I think it is being done in order to make us understand the magnitude of the disease and the magnitude of the infection rate. Now, you must understand that there are two, we're living in a world where there are two concepts that in a way collide with each other. And one concept is that we should all of us go into full mode of protection. And the other way is actually to say we should open ourselves and whatever happens, happens. And I think that you can, if you look really and you look at the data, you'll find the data also presented by day data. And you may see the data presented as a cumulative numbers. I think that the important thing is to try and look at it at a very clear and calm way. And this is that we're dealing with a virus that for some groups in the society can be and can pose danger. However, we must understand that unfortunately for the next year, year and a half, maybe 2 years, we'll have to learn to live with the virus and try to change and in a way to make ourselves adapted to living with the virus and to the dangers the virus is posing to some of us.
In the meantime, we receive other questions on the chat. One question would be, what is your advice about traveling these days? Is it including Israel, but in general, Europe or in other parts?
The answer is that I think the issue of travel is, first of all, in Israel, within Israel, I don't have any hesitation. I can tell you that I'm traveling. So I think that that's part, obviously, traveling, taking all the precautions. Traveling abroad is a different question. I think that it is at the end of the day, a decision of each one with himself and each family for itself. And there are risks in traveling. On the other hand, we know that in Europe, some of the countries like Greece and Italy are opening for tourists, and they are saying that they are safe. And I would say the following, that it is everybody's decision whether to travel or not to travel. It's obvious that traveling today is a challenge compared to what it was before. At the end of the day, I believe that we will learn to live also with traveling with the virus. At this stage, and I'll be open with you. When it comes to me and my family, I will not travel this summer.
Understood. Thank you, Professor Weiss. Another question is about the conflicting messages that people are receiving from mass media, and Israeli epidemiologists who say that one cannot get the virus on the streets. What should we do? Should we wear or not masks on the street or in public places?
The answer is that, you know, that when we started with the infection, we said that there's no reason to put masks. What we've learned the hard way is that some patients can be super spreaders, and some patients can have a very high viral load and they spread the virus. It is important to understand that the mask is not there to prevent so much us from getting the virus. It's more as a precaution for us if we carry the virus to spread the virus around. Because when we carry the mask, we don't allow a mist, a cloud of viruses to be lifted in the air and spread around. And I think this is the reason that the masks are being made compulsory all over the world and in Israel also. And I think there's very little argument today, at least in Israel and among us here in Israel, that there's a good reason to tell people to wear masks. And in Israel now, the police and the other municipalities are putting a lot of emphasis, making people and making it compulsory for people to wear masks because of the protection it provides, not to yourself, but especially to your peers when you cross them around. Please understand that the question on the street, it's very difficult to get infected on the street. And the reason is that if you're walking, even if you cross someone with an infection, if we don't stay for a longer time in contact with him, and we usually speak about 10 to 15 minutes with someone in close contact with someone who's carrying the virus, the chances that you'll get the virus are limited. However, if you have super spreaders, we know that with super spreaders, even as close contact can end up with an infection. But that's life. And unfortunately, we're living with nature, and nature provides us with surprises. But at the end of the day, wearing a mask is actually providing a protection not to us, but for our peers. And I would say, yes, please wear masks.
Understood. Thank you so much. One last question. However, they are still coming in many of it. We are hearing about genetic manipulation. What if the virus would be manipulated genetically? Could it be this done in advantage of us, of people, making it less dangerous?
First of all, the virus now is out it's very difficult to manipulate the virus now because the virus now is already out of control. So it's out of our hands. At the beginning when it started, there were discussions whether the virus was released from a laboratory in China where it was manipulated. I should say that, you know, it's an educated guess, and I would say the following. I think that if it would have been a virus that was created in a laboratory, then they've done a very, they didn't do the best job they can. Because if in the laboratory they take the SARS virus and they make it as contagious as this virus, obviously it will be a much more dangerous virus. The virus we have at our hands is a virus that at the end of the day, although it is very contagious, it has a relatively low risk and a low death rate associated with it, except for very specific populations. And for this reason, I think that most probably it is a virus that was migrated from bats, that's what we think today, from bats in China into the human population. And we know that coronaviruses are moving from, because of the pressure that wildlife is finding itself out in these days, because we're becoming closer and closer to wildlife, there's a much higher incidence of viruses crossing from animals, especially from other mammals, into us human beings. And I think this is much more reasonable that this is what has happened. Can the virus change itself and undergo a mutation, which is a random mutation that will make it much more dangerous? The answer, this is always a possibility, and we addressed it at the beginning, and the answer is unfortunately yes.
Thank you so much. Mickey, are you online? Unfortunately, at a specific moment, he dropped off. Yes, but he's back. Thank you.
I want, Mickey, Mickey?
Yes.
I want to add one more comment because it's a question I was sent by email and I said I will answer it. And it's a very interesting question, actually. Mm-hmm. In the United States, there are a few groups that started looking at another way of developing let's call it an indirect medication for the virus. And this is exposing us to vaccination, to polio and tuberculosis. And the idea is actually in exposing us to these vaccines against viruses, which are very easily to give. It's either a shot that you get under your skin, or with polio, even swallow it. And the idea is that before you get the virus, we activate your immune system. And in a way, we make our immune system more aware of its surroundings, so it is prepared in order to fight the coronavirus. So this is making it simple. This is one of the things that they're trying to do. And this is based on looking at countries where there's a very high rate of vaccination against polio, where they have an understanding or a feeling that the relative number of very sick patients is much lower, example, Pakistan. However, it is important to say also that these are very, very, very preliminary data, and we're not sure that at the end of the day, this will really pan out at something that will be effective at the end of the day. Sorry, Mickey. I apologize if I interrupted you.
All good, all good. Unfortunately, I'm afraid that in a few minutes, this meeting has to come to an end. And at this point, I would like to ask the multi-talented Jorge Dina, another asset of Hadassah and the best ambassador of Hadassah I could think of, to speak the final word and give us an outlook maybe to the upcoming Summer Summit events that we'll host in the near future. Jorge, the stage is yours.
Thank you, Mickey. Yes, thank you, Mickey, for organizing and hosting this amazing, outstanding event. You are an incredible host. I think we're going to take you for many other webinars to be the one that interviews. You know, we are Dr. Mickey Saks, and you come with all your medical knowledge and your provocative, you know, thinking. And I think it's pretty much our style. So, you know, you are in for further webinars moving forward. Thank you, Janice, for your German-English opening words. They were, I know that you have prepared, you know, all these words in German, and we didn't have a chance to share all of that, but, you know, I'm sure we will do that in the future. And my last thank you and connects to my closing words, is for Yoram. You know, there is something about, I think we all know that in this moment of COVID-19 and this pandemic, you know, there is a very important role for all the medical knowledge and all the work that doctors do as professionals. But as important as such is the role of communicators and giving us some kind of like balance and making sense of what's going on. And Yoram, you know, for many of us, you know, definitely for me and those who are very close to leadership and management of Hadassah, you know, it's not the first time we listen to you through this pandemic. And I think there is something very comforting about listening to you, even if you have to share, I wouldn't say pessimistic, realistic information, but just the way things are. Just, you know, when you say we might have to get used to 18 months of living with COVID, or maybe 2 years, you know, it sounds different from somebody who would say, you know, in 2 months it's over, and, you know, we just don't trust. So we really trust you. I think we are proud of having somebody like you at the top of Hadassah Ein Kerem, the place where COVID-19 is being handled for the residents of Jerusalem and in Israel. And there is one thing, you know, at the beginning of your presentation, you spoke about our patients. And I was thinking, you know, who are our patients when we speak about Hadassah? 2 hours ago, for those who don't know, and probably most of you still don't know that, I was sharing the manual of protocols of the Hadassah Medical Organization, prepared by Professor Yoram Weiss, together with many other people at Hadassah, at the Chamber of Representatives, the House of Representatives, the Parliament, and the Senate of Argentina. And this is going now to millions of people in Argentina, to hundreds of medical centers in Argentina, with the knowledge that was created by Yoram. So can we say that our patients are just the patients that come through the gates of the Hadassah hospitals in Jerusalem? I think that wouldn't be accurate. The patients of Hadassah are people all over the world who have benefited from the knowledge, the know-how, and the continuous learning of people like Yoram, led by Yoram and others, working to make sure that the war is healed in a time of crisis. Thank you, Yoram, for your leadership and what you do. We are closing this event. I think I can't count already. I think this is the 7th event of our Hadassah International Summer Summit, Health Talks with Hadassah Experts. We are going to have 2 amazing events next week as part of our summit. We're getting close to the end of the summit, but we have 2 very, very important events. One with Professor Esti Galili on Sunday regarding post-trauma, depression, how to handle the psychological effects of living through this trauma, that for many people it is trauma, and most of us, there is some traumatic elements. And on Monday, the prime event of the week and one of the most important events of this summer summit. And it's not about COVID-19, because, you know, we have to live with COVID-19, which means we need to continue our lives. And when it comes to health, all other things continue to be relevant. We are going to have a panel on transformation and innovation on cancer research and treatments. An amazing panel. It's an event organized together by Hadassah International and HWCOA, the Hadassah Women's Science Organization of America. You are all invited. It's Monday at 1 p.m. Eastern Time, 8 p.m. In Israel, 7 p.m. Central Eastern Time, Central European Time. And you shouldn't miss that event. It's a pleasure to have you all through these webinars. I think we all learn, and by learning, you know, we feel we are getting to a better end of this period. Thank you so much to all the participants. Thank you to our speakers. And again, thank you, Mickey, for leading an amazing webinar. Have a great day and a great evening. And for those who are in America, and I see a lot of friends from America, have a great Independence Day weekend. Thank you all. See you next time.
Bye-bye.
Bye.